So hi there. I have a patient that would love to share, her experience with upper cervical chiropractic. So tell us a little bit about what brought you into the office.
I'd had constant headaches and dizziness for months, and I was pretty much bedridden. I had been given prescription medication for migraines, for headaches. I had seen multiple specialists, neurologists, cardiologists, you name it, physiatrists, and I even saw a spinal surgeon who said that I should probably have my neck fused if my symptoms were not resolving. And I mean, who wants, screws in their neck? I sought options. I started doing, a lot and just endless research. And through a Facebook support group, I saw a testimony of somebody who had symptoms similar to mine. And they talked about their neck and seeing a cervical specialist. So I called a lot of numbers, and it was a missed call. I had called here and it was a missed call. And thankfully, you returned my call. And I explained my symptoms, and you took the time, which I really appreciate, to listen to me. And there was a light of hope that you could help me. And I eagerly looked forward to coming in here. The day that I came in here, I drove because I drove myself. I almost had to hold my neck up, and I was shaking, my heart was racing. Those are the symptoms that I'd had. I was actually diagnosed with POTS, a symptom of, I had tachycardia. I couldn't sit or stand upright for longer than 5 minutes without my blood pressure going up. I even had been on a beta blocker that day. A cardiologist had given me a beta blocker. And after I came here, after you analyzed all of my x-rays and etc., which I, again, appreciate. You weren't doing this blindly, and then you did your own examination. And the second you did the adjustment, I felt a gasp of air. I felt like, I don't know if you remember asking me, I could breathe better instantly. And as soon as I got up, that vertigo, that dizziness wasn't there anymore. And I felt like a sense of calm that I had not felt for months. I was able to drive home calm. I was able to, for the first time in months, sit down and have dinner. And I surprised myself, the stamina of walking around and not feeling like I was gasping for air or extremely exhausted. And it's been, about a week since I've been here, and I'm no longer confined to a bed. I promise you, I ate in my bed. I did work from my bed. I did everything from my bed. And after just one adjustment, I'm amazed. That's no longer the case.
Tell us about, because you shared about your having dinner with your parents, right?
Oh my gosh, yes. So they came over yesterday, and my dad noticed. He was just observing me, and I asked him why he was staring at me, and he said, I've noticed that you're up and you're walking around, and you had dinner with us, and you're sitting upright and watching TV with us. That was not the case for many months. I'd see them about once a week, and they would come over, and I couldn't enjoy social time with them. They would come over and we would watch a movie, but I either had to be laying down flat, or I would take breaks. I would watch 10 minutes of the movie, go lay down for 30, come back and spend time with them, go back to my bed. They would bring me my dinner, and I would eat my dinner in bed. I'm an educator, and I teach, and I would have to turn my camera off and teach from my bed,
Because you had to lay down.
I had to lay down. I couldn't sit up because I would have excruciating neck pain, dizziness, and I would feel like my heart race. And I would take my blood pressure, and sure enough, it was rocket high.
Sure.
That's not the case. My blood pressure has completely returned to normal.
Yay.
I got off the beta blocker, and I am so grateful.
Yay.
And
Awesome.
that I found you.
Yay. Awesome. So thank you for sharing that information. Anything else you want to add, or that I think that was really, really good.
Well,
it was really inspiring.
I think that if you have, I wouldn't put, one thing I learned is that not all chiropractors, I would not put them all in one box. And I had seen many, many chiropractors, and you have a one-of-a-kind specialty, background, education, state-of-the-art technology, and you're extremely thorough and confident with your abilities. And I don't, that's all I can say. Not all chiropractors are the same. You're one of a kind, and
Thank you.
Yeah.
Thank you for sharing. And
yeah, no problem.
I'm definitely hoping that this video does go out to other people that are struggling potentially with POTS, but also just dizziness and blood pressure issues, and really looking for a solution. And they don't have to resort to surgery. They don't have to resort to drugs,
Right.
to manage a condition, because that's really not a solution. So thank you for really listening, and thank you for really sharing. Thank you.
You're welcome.
Appreciate it.